Now, from the station that's taking action for you, this is ABC Action News at 5.
I'm consumer reporter Carrie Cavanaugh. Should insurance companies be recommending prescription drugs? Some say that's a dangerous practice. I'll explain why coming up.
In other news, who should be recommending prescription drugs to you, your doctor or your insurance company? Choosing an alternate or generic medication may save you money, but doctors say that doesn't always fit the bill. Consumer reporter Carrie Cavanaugh takes a closer look at the so-called practice of drug switching.
Jonetta Fillenbaum's recovering in a hospital bed one day after her first seizure in 3 years.
But I woke up in the ambulance, and then when I got here, I had another seizure.
Jonetta suffered from epilepsy since the age of 7, but says she's controlled her disorder with a brand-name drug. Last fall, Jonetta says her insurance company stopped covering that drug and asked her to switch to a generic.
When I took it back, they said that's all that the insurance would pay for.
Jonetta says paying out of pocket would have cost her $700 a month. Florida consumer advocates call that drug switching. In many cases, it involves switching from a brand name drug to a lower cost generic. Epilepsy specialist Dr. Salim Ben-Badi says while oftentimes generic can be safe and cheaper alternatives, it's not always the case.
For certain medications, a little fluctuations up and down of the medication level in the body is inconsequential. For example, high blood pressure medications, cholesterol-lowering medications. For a disease like epilepsy, which is what I do all day, it matters very much.
According to the Florida Consumer Federation, some insurance companies are now sending patients letters telling them to switch to a cheaper drug. So on the one hand, you have generic substitutions. On the other hand, you have what's called therapeutic substitutions, and those are different drugs altogether.
Especially if the medication has been working for the patient, you know, the old adage, if it ain't broke, don't fix it. But so you just never know what's going to happen with that.
Dan Fucarino with the Carrollwood Pharmacy says pharmacists should first check with your physician before switching your prescription. If they don't, you should call the doctor before you take it.
Even though they don't have you under their medical care and they don't know you personally, that they can control what you take.
Jonetta hopes that her insurance company will now work with her to give her the medication that has so far kept her out of the hospital. In Tampa, Carrie Cavanaugh, ABC Action News.